And yes, we come now to the satellite symposium. And there I ask Ivo Petrov, the director of this congress, what he is talking about crossing the mesh.
I would like to ask Professor Vasilev Dobry to join us for the satellite symposium regarding the lipid lowering treatment. In fact, this is the satellite symposium of Novartis, and we will ask the guys to activate the first presentation. Yeah, thank you so much. Nothing to disclose regarding this presentation. So all we know how important it's clear during the last several years how important is to reduce the LDL cholesterol in order to improve the prognosis of the patients, and mainly with the main goal is to decrease the incidence of atherosclerotic occlusive diseases. In multiple trials, the LDL cholesterol is shown, is approved as the main risk factors, for the development of atherosclerotic occlusive disease. And there is a direct relationship between the levels of cholesterol and in fact, the hope and the good thing is also the reduction of the LDL cholesterol is also is reducing the incidence and the risk of these patients. There is a direct relationship between the level of the cholesterol that is definitely shown in a very special group of patients. These are the patients with familial hypercholesterolemia, and they reach the risky levels much earlier in their lifespan. So this is the reason the incidence of atherosclerotic disease is appearing much earlier in their age, and the average life expectancy for familial hypercholesterolemia patients is only 40 years. And this is the reason we are commenting in many cases, this is the reason that we don't see elderly patients with familial hypercholesterolemia. This is the reason, because they are die young. So, and the biggest problem it's definitely it's under-recognized and lately recognized. So it's very important to pay attention in our daily practice, and I will show our Bulgarian trial how convincing was. We published in Advances in Therapy from 5 hospitals from different regions in Bulgaria. We have shown how much under-recognized is the FH, and even how under-treated are these kind of patients, not only before the hospitalization, but even after the dehospitalization. During the follow-up, we see that still they don't receive the guideline-based LDL cholesterol reduction therapy. And you know that during the last several years, we have new possibilities. There are not only the statins, there is the biological therapy, the antibodies or the SIRNA, the silencing RNA particles that are giving hope. In fact, these are the goals of the therapy. We know very well that depending on the score, depending on the risk score, the higher the risk score, the lower is the target level of the LDL that we have to achieve. And this is the hope came with the PCSK9 targeted therapy. PCSK9 is a special, in fact, convertase protein, multi-protein convertase that is playing a very pleiotropic role, not only for the LDL receptor that are expressed on the surface of the liver. This is definitely the main mechanism. So in fact, the PCSK9, they don't allow the liver to exert the LDL from the body. They are blocking the LDL receptors, and on such a way, they are, this is our enemy, the physician's enemy. And what is the LICFU, the inclisiran, doing? This is the so-called silencing RNA molecule that is in fact mimicking the genetic material that have to produce the PCSK9. And in fact, the beauty is that is not inhibition of the PCSK9, but it's not production of the PCSK9. So the inclisiran is unique in this regard, that is in fact doesn't allow to our body to produce the PCSK9. There is a group of trials, the Orion group of trials, especially I will emphasize on Orion 10 and 11, regarding, of course, these are randomized trials. The Orion 10 and 11, they are multicentric, randomized, blind, placebo-controlled trials, showing how what is really impressive, the result compared to the placebo and over the guideline-based therapy. So it's something above. It's really a therapy coming above the guideline-based therapy. The comparison with placebo is dramatically in favor of inclisiran regarding reduction, all the main target of the trial. It's in fact it's reducing dramatically the incidence of all the events, of the clinical events, because of the really dramatic reduction of the LDL, more than 50%. You see that really the difference with the placebo group is really impressive. I mentioned already that the PCSK9 role is not only regarding the metabolization of the LDL cholesterol. There are multiple data nowadays that the therapy against PCSK9 has pleiotropic effect, because the PCSK9 has pleiotropic effect. And there are several very important, the majority of them Chinese trials, showing that the PCSK9 has a huge role in inflammation. And you are aware that during the last several years, we have to recognize that Rudolf Virchow, 130 years ago, he was right to show that the atherosclerotic aggregation process is triggered by the inflammation. So the LDL cholesterol, to build the plaque, we need inflammation. And there is a very interesting experiment trial showing that, in fact, mixing PCSK9 culture and phagocyte and monocyte culture is increasing dramatically the inflammation inside the artery, and after that is coming the aggregation of the cholesterol. And it was shown not only by microscopy, but also by nuclear methods, showing how significant is the inflammation when the PCSK9 culture with inside of the experimental animal. There are multiple publications already showing that the PCSK9 is increasing the CRP, is increasing the phagocytosis of the LDL cholesterol, is increasing the incidence of the so-called foam cells. The foam cells are the major part of the destabilization of the plaque. So the PCSK9 target is really absolutely reasonable, not only because of the liver and the LDL receptors, but also because of this picture that is showing the micropores that are in fact elaborated within the endothel, allowing by the PCSK9 facilitated process of microporation of the endothelium, allowing the LDL cholesterol to be introduced below the endothelium inside the media. In fact, this is the plaque building start. So because of that, probably the impressive are the result by the PCSK9 non-production by the inclisiran. And it's shown also by IVUS examination and also very, very interesting experimental trials showing really how important, how stated here, the inclisiran is inhibiting the pyropoptosis induced by the oxidized LDL. That, in fact, is telling us that the stopping the PCSK9 production even can play a protective role of our arteries, not only preventing the LDL to be circulating, but also protecting of being penetrating the endothelium. The beauty, Bulgaria is, we are used to be not very in front of the innovations and so on, but in this case, we have to admit that in Bulgaria we have really the full spectrum of possibilities to treat the patients with cholesterol and atherosclerotic problems, probably because the burden of atherosclerotic disease in Bulgaria is enormous. But fortunately, nowadays we have both the biological therapy with monoclonal antibodies and also the treatment with inclisiran, the SIRNA, the silencing RNA molecules are in our armamentarium on a national basis. We have 12 specialized commissions with already hundreds and hundreds of patients that are included into the national program, fortunately for their very improving prognosis. Thank you very much for your attention.
Yeah, thank you very much for that overview. My Bulgarian language knowledge is not so good, so I could not read everything. But I could hear what you're talking, yes. And one question I have is, are there some examination concerning the influence of physical exercise and sport on LDL?
Absolutely great question. In fact, the physical exercise is reducing the LDL cholesterol, and both is reducing the inflammation. And because of that, nowadays the holistic approach is definitely on #1 place into the European guideline regarding the target for reducing the risk for atherosclerotic disease for the patients that are under risk, definitely. And also the same effect is exerting stopping smoking.
Yes.
Same way. So it's very important to pay attention. It will be, please remember, it will be more and more actual to pay attention both to inflammation and to LDL cholesterol. So LDL cholesterol reduction is not sufficient, and because of that, the trials like the Jupiter trial have shown that LDL cholesterol reduction is leaving behind still unmet need. And in case we reduce also the inflammation, the prognosis is improving even more.
The problem with the LDL, unfortunately, sorry, Ivo, just as a continuation of what he said, the problem is that you cannot change your genes. I mean, that with exercise, with changing your habit of life, you can change and you can decrease the LDL cholesterol maybe 5 or 10%. But this, for reduction of cardiovascular risk, unfortunately, just looking on the LDL is not enough. It's definitely not enough, and I have a lot of patients, good sportsmen or sporting women, but with enormous coronary artery disease or peripheral artery disease, unfortunately, just because of exactly what we are talking about the familial hypercholesterolemia, and this is a huge problem, and unfortunately, exactly those patient groups we should target with medicines like inclisiran.
Please come and continue. Professor Vasilev will give you more data about the reduction of LDL.
Okay, so thank you, Ivo, for
Then we have
invitation,
coffee
and
break.
thank you from Novartis about giving me opportunity to talk about this topic. I apologize that the slides are on Bulgarian, but I hope that you will understand what I'm talking about. So we will discuss, I don't have any conflict of interest regarding this presentation. I think that nobody will be surprised in 2022-25 that practically the atherosclerosis is mainly caused by lipid accumulation in our arteries, and these are causing myocardial infarctions, heart failure, peripheral artery disease, cerebral vascular disease, and sudden death. And unfortunately, this is still a problem, and exactly for the patients with familial hypercholesterolemia, doesn't matter is it heterogeneous or homogeneous, it is a huge problem even in the younger age. The diagnosis of familial hypercholesterolemia is not so difficult, but we have to think about this problem. This is the main which we have to start with when we have some patient, especially in younger age, especially in age less than 40, less than 50 years, that this patient probably should be diagnosed with familial hypercholesterolemia, mainly because the criteria are clinical, and it is not so difficult to put the diagnosis regarding this entity. And Ivo already shown our national trial, which we made regarding the frequency of the FH in Bulgaria, and treatment, unfortunately, the treatment was not satisfactory, and these unsatisfactory results are not only in our country. This is the Santorini trial. It is performed in 14 European countries between 2020 and 2021. And it clearly demonstrated that more than 70% of patients who need LDL decrease and control of LDL cholesterol are practically undertreated, and they don't receive their target levels of LDL, which is extremely important. Why it is important? Just at the end of the January in Lancet, it was published the 10-year results from Scott Hart study, which unfortunately I didn't have enough time to add the slides about this, but generally in 10 years, the Scott Hart study clearly demonstrated that CT-guided treatment of coronary artery disease, which means that even patients with just atherosclerotic changes in their coronaries, but giving them statins or other anti-cholesterol treatment plus ACE inhibitors, definitely decreases the death rate, the cardiac death, and the rate of myocardial infarctions. Few days ago in Euro Intervention, it was published the second study with the 3-year results, which comparing 600 patients at more than 300 patients in each group, which clearly demonstrated that if the treatment of coronary artery disease is guided from CT, and just by detection of the coronary artery stenosis and going more aggressively to decrease the LDL cholesterol, leads to decrease of cardiac mortality directly. This is, I think, the hardest endpoint without increasing the non-cardiac mortality. So, and these are results regarding the decreasing, the extent of this decrease of risk depending on how aggressive we are with decreasing the cholesterol. And as much as we are aggressive by decreasing the cholesterol, as much as we are adding the dosage of the statins, we can decrease the risk for death and MI. And this is some practical example that if the patient should be with the level of LDL cholesterol less than 1.8, and we add, and this patient is already on the maximum statin therapy, the maximum dosage of the statin therapy, and if we add ezetimibe, this patient basic risk of 10 years mortality is 20%. And if we add ezetimibe, we decrease with the risk for this patient with the 2%. It is 20% relative risk reduction, but 2% absolute risk reduction. And this additional decrease to target the level of LDL cholesterol leads to 18% risk at 10 years of mortality. If we are more aggressive by adding inclisiran, for example, and decreasing the LDL more than 50%, like it is in guidelines, these patients have in total 25% additional reduction of the risk, and his or her absolute risk decreases from 20 to 15%. 55% if you don't think that this is not enough for you, this is 1 in 20. So you are saving one human life in 20 patients in 10 years. So I think that this is quite a good result for the treatment. The big advantage of inclisiran is that actually the results which we achieve with giving inclisiran, that it gives sustained results. These are results which are keeping at 9 to 12 months after 2 injections only. And it is extremely important that it improves that the patient is taking his or her medicine. And now we have extended data from Orion 8 trial, which is accumulating data from Orion 1, 3, and 9, 10, and 11 regarding the safety and efficacy of inclisiran up to 3 years, just to see is it safe to give inclisiran for long term, because more or less this is epigenetic therapy. So we still don't know what happens in the long term, because we are directly targeting here the gene's activities. So at 3 years, the results are really promising. The efficacy is absolutely stable, with 78-79% of patients still having target levels of LDL cholesterol, depending on the baseline risk, and the rates of adverse events is extremely low. So we can say that this is one of the most promising treatments at that moment which we have for FH. So thank you.
Well, thank you very much. Are there questions or comments? No?
Maybe no.
You have convinced everybody.